Hi, I'm Tara Phouthavongsa. I work for Boston Scientific as a Watchman clinical specialist. Watchman is a left atrial appendage closure device that we place in the heart, and it helps get our patients who have atrial fibrillation off of their oral anticoagulations while also preventing embolic strokes. My interests, hobbies, pastime, I love reading. I like history. I do love anything outdoors, any sports, uh, music, cooking, eating, anything that I have to do with my friends or family. My journey from high school to my current career, I had no idea what I wanted to do in high school. I was completely lost and honestly just very focused on sports. So when I did graduate high school, I got a sports scholarship to the University at Buffalo in Buffalo, New York. I went there and I did pretty much just my prerequisites because again, I was confused and I wasn't sure at 18, what I wanted to do for the rest of my life. After my first 2 years, I took about a year off. I moved back home and then I just thought any degree at this point is better than no degree. So I went back to school at SUNY Brockport. I'm from Brockport, New York, and I got my bachelor's degree in health science and biology. I thought, I don't know, maybe one day I'll want to be a science teacher or an accountant. I literally had no idea. I took every sort of class under the sun. Then one day I'm standing in the kitchen and my mother looks at me and she says, "Hey, have you thought about nursing?" And I laughed at her. Me, I never really thought of myself as very compassionate or caring or super loving. So the idea of nursing wasn't very exciting to me. But I decided she's so wise, I'll give it a try. And I didn't really have any experience or classes that went with it. So I found a job as a home health aide, which more or less is just me going into a client's home and taking care of them, maybe helping them bathe and feed and give them medication. It was more or less just a reprieve for their caregiver. And I actually really liked it and it felt so good to help people. And then I thought maybe I should kind of stay more on this path of healthcare, but more of just helping people. I ended up applying for and getting a job as a PCT, which is a patient care technician at an oncology clinic in Rochester, New York. And I loved it. I loved everything about it. I loved hearing the patient stories and learning about the medicine. And I made such good friends with the nurses. And I loved everything about it that I decided I'll try to apply and get into nursing school. And I had some prerequisites taken care of, but I needed to get better grades on others. So I was taking classes while working at the cancer center. Then I got into the 2-year nursing program at our community college. And I finished there and I took my NCLEX. And I had to wait 3 days to get the results of my NCLEX. And I was so stressed out. And I was thinking, oh my gosh, if I didn't pass this, I cannot take this test again. I can't do this to myself. It's so hard. But I found out that I passed and I was so excited. The first position I took as a registered nurse was in the neuro ICU at the University of Rochester. I started that job in July, and then right as school started back up in September, I was working towards my bachelor's in nursing. I worked in the neuro ICU for a few years, and then I decided that I wanted to be a travel nurse, which anybody who's even thinking of nursing, I tell them, please go travel nurse. It is so exciting. You can see so many different places, different jobs. You get so much in terms of clinical experience and bringing things into your practice that you might not have learned where you stayed. So I took my first travel position in a neuro ICU in Greenville, South Carolina. I did about 6 months there, and then I headed to Houston and was in a shock trauma ICU. And then after my 6 months there, I took my last travel position in a solid organ liver transplant ICU in Milwaukee, Wisconsin. And I was working there, and a girlfriend from home had called and said that if I was looking to get out of bedside and I was looking to move back home to Rochester, that she knew somebody that had a position at Boston Scientific. And I was definitely looking to get back home. So I gave them a call and I interviewed for maybe 2 or 3 months. and then I got the position. So a day in the life of a Watchman clinical specialist. I cover about 6 or 7 different accounts, hospitals in the Milwaukee area. So I'll go to my account for the case, and I will be in the cath lab or the EP lab, and I will help decide what sheath type to use and then what device size to use in order to close the appendage. Sometimes we'll have only one case, sometimes we'll have up to 5. So mostly my day consists of measuring the appendage, making sure it's appropriate for the device, and then helping the staff prep the device, and then helping the implanters put it in, and then making sure that we are leaving a device that's okay, that won't leave the heart, and that the patient is 100% safe to come off of their medication. The best part of nursing, probably that I miss not being in bedside for, is you make friends, and these are your friends for life. Like, you are in the trenches. These are your brothers and sisters you go into battle with, and you see some things and you learn some things. And these are people who understand at the end of the day what you're feeling, what you're thinking, and how badly you need to decompress. So advice I have would be, in any career, not even just STEM, there is no correct way to get from A to B. However you get where you need to be, any obstacles, life that happens, all of that is very important to build who you're going to be and make you a better professional.